The medical cannabis program in Israel is the oldest and most advanced in the world. And Alvit Pharma is one of the industry's leaders specializing in the development of cannabis-based products. Jon Steinberg, the president of news at Altice USA, our parent company, sat down with the CEO of Alvit Pharma, Yona Levy.
Hi, I'm Jon Steinberg for I-24. We're here in Jaffa Port in Tel Aviv, and my guest tonight is Yona Levy, CEO of Alvit Pharma. Thank you for being here tonight.
Thank you for having me, John.
So you're one of the CBD, you're one of the big marijuana companies here in Israel. Did I get that right?
Aside from the part of the CBD, we deal with the whole full spectrum of cannabis.
Okay.
THC, CBD, everything.
All right, well, it's huge here, right? I mean, I was in doing my research. There's 100 companies in Israel alone that are in the space, right? Why do you think it's gotten so big so quickly?
I think more than 100 companies. I think one of the key elements was we do have in Israel one of the oldest program of cannabis. Cannabis also falls exactly at the expertise of where Israel have agro, biotech, security, technology. It's need a certain specialty to work with it, and regulation in Israel has been very kind as well with research. So Israel, definitely leading the industry in a certain way.
And when you say that the regulatory environment here has been favorable, what does that mean?
If you want to do research on cannabis in Israel, in America, let's say in the US, okay, you have to go through a whole FDA route, which is relatively expensive and require, a certain amount of time that is, pretty long. In Israel, you can get the license for research, much faster with less commitment for funds, and you can have your team working on it until you get to the right idea, much faster and cheaper.
And then in terms of usage here, I know that it's completely decriminalized right now. Is that accurate, marijuana?
It's not exactly, because if they do caught you using it with not for medicinal purposes, at the beginning you might get a fine, and then there's like stages along the way. It's not like you can use it and no problem.
Right. So it's not recreational like it is in certain states in the U.S., but it's fully decriminalized, right, for medical use.
For medical use, it is legal. It's not.
Right.
Yeah. So for medical use, if you need it, you can go to a specialized doctor. He will prescribe to you. You will receive it and pay for it, and that's for medical use.
Prescription required.
Yes.
Okay. You say in kind of your messaging around your company that we make everything about cannabis simple for the doctors. What does that mean?
We believed in the company the doctor would not want to prescribe 2 puffs 3 times a day.
Okay.
They would like products that speak their language. API, what's exactly inside there, bioavailability, how much of it gets into the body, onset time, offset time, when does it start, when does it finish, and they would like to see a clinical trial. And that's what we've been working for the last 6 years. And
what is the slate of products that you make available to the doctor? And do you have a set of product for a set of indications and usages, or how do you go about making it productized?
So for example, if you want to deal with pain, one of the first most important thing is you want something that solves your problem quickly now. You don't want to wait to, okay, I'll solve it to you in an hour. So in that sense, we'll go with a sublingual tablet, where we just finished a trial with one comparing it to another drug that is available on the market by a big pharma company, and we deliver much more. So that's the kind of stuff that we would do. If you deal with another indication, you will deal with a different delivery mechanism and different API.
How many products do you have on the market right now?
So this is a very challenging one, because there's no product anywhere in the world yet that is not flowers and oil.
Okay.
The market right now is requiring, the demand in the world is flowers and oils. What we're suggesting is cannabis 2.0, okay? We are all ready to supply them with flowers and oils like everybody else, but we think that shortly, soon, doctors want something that actually speaks their language. And that's why we're building right now the largest facility in Europe to supply that need.
Well, and that's in Malta, is that right?
That is in Malta.
And what are you building in Malta right now?
We're building a 140,000 square feet facility with rights to cultivate and actually full pharma grade, a factory for full pharma grade products, which is a first, in the world.
Wouldn't the government want you building it here, and why can't you build it here?
This is kind of painful, I should say.
Okay.
We did want to do this over here, but the export is not fully finalized, and we kind of learned that it makes more sense that if you want to sell in Israel, grow in Israel. If you want to sell in Canada, grow in Canada. And if you want to sell in Europe, in the EU, grow in the EU.
And do you have fields? You have fields here in Israel right now?
Yes, we do. We have another publicly traded company called Intellicana that is trading on the Tel Aviv Stock Exchange that is growing over here in Israel and selling over here in Israel.
And what's the scale of that? I mean, since it's public, you can tell us. What's the scale of revenue numbers that you're doing right now for the Israel entity?
So we just signed an agreement not long ago to sell for the first 3 years about $24 million worth of flowers, cannabis to a producer over here. So that's the kind of scale you're talking about for a company like that.
What's the social attitude towards cannabis in Israel right now? I mean, in the U.S., it went through, I'd say, a series of kind of decade cycles, where obviously in the 60s there was a huge amount of acceptance for it, and then you could argue that during the 90s it kind of went out of favor, and now I would say that it's sort of more accepted. People's parents basically smoke marijuana for pain management and the like. I mean, what's the social norm here?
I'll touch America for a second.
Go right ahead. Yeah.
If you notice, America is paying and paid for the last few years a deep price on opiatic drug trying to deal with pain.
Absolutely.
I think you have the number of 50,000 dead people.
It's a crisis.
Exactly.
Yes.
And if cannabis would have been, allowed before, some of those numbers couldn't be saved. And you see that in the first country that actually legalized. And you see the opiatic sales, dropping down, crime dropping down. So America have done that mistake. Israel have done that mistake as well. And it is opening in the same way it's opening in America, meaning, cannabis deal with many indications, starting with pain, cancer, epilepsy, Parkinson, Crohn. The list is long. And unfortunately, there is no family that haven't got a visit by this, those diseases. And when you unfortunately have to deal with this, you realize that, hey, this is helping.
Yona Levy, it's been a pleasure. CEO of Alvit Pharma. Thanks for being here on Israel Business Weekly.
Thank you very much for having me.